Hi guys, welcome back to the channel. Happy Max Facts Day, by the way, anyone listening there. Now we will continue with the Exodontia topic. Let's start. We have dealt with the definition, contraindication, indications, and what all we need. Now we are going to deal how we'll go for the patient. First of all, the surgeon preparation, washing, scrubbing, eyewear and surgical gown, and wearing of gloves. Wearing of gloves should be last thing. Then patient preparation, prophylactic antibiotic if needed, prophylactic mouth cleaning and scaling, and patient draping. Okay, tray setup or armamentarium, that is instrument use, local anesthesia, mirror, tweezer, probe, cotton pallet, forceps according to the tooth or root to be extracted, elevators if required, bone file ronger when required, curettage, needle holding forceps and suture material when required. Okay, this is a brief description of what when we should use that. Now coming to extraction technique. First, there should be adequate access to the tooth. Then coming to British technique. This technique which we follow in our clinic or daily practices. Okay. Forceps always held with the palm of the hand above the handle of the forceps. Above the handle of the forceps. Patient is inclined 15 to 30 degree for extraction in the lower left quadrant and 30 to 45 degree in the other three quadrant. लोअर लेफ्ट में पेशेंट 15 to 30 डिग्री पे इंक्लाइंड होना चाहिए, बाकी सारे क्वाड्रेंट के में 30 to 45 डिग्री पे. Now, dentist stand back or behind the patient for extraction in the lower right quadrant, that is fourth quadrant, and in front for all other quadrant. The lower right quadrant के लिए behind खड़ा होना चाहिए, that is known as right back position, and बाकी सारे quadrant के लिए right front position. Now coming to position of supporting hand and chair. For a maxillary extraction, the chair should be tipped backward, and maxillary occlusal plane is at 60 degree to the floor. It's almost at 60 degree to the floor. The height of the dental chair should be 8 centimeter below the level of operator's shoulder. It should be 8 centimeter below the level of operator's shoulder in maxillary extraction. And for mandibular extraction, the patient should be positioned so that the occlusion plane is parallel to the floor. In maxillary, it should be 60 degree. In mandibular, it should be parallel to the floor. And the chair should be 16 centimeter below the level of operator's elbow. In maxillary, it is 8 centimeter below the shoulder. In mandibular, it is 16 centimeter below the elbow. Now there is one more technique known as North American technique. This technique is not followed here, but the little bit thing we should know. Forceps are usually held with the palm of the hand below the handle of the forceps. There we use above the handle of the forceps, and here below the handle of the forceps. In this, patient is inclined to 30 to 45 degree for all quadrant. In British technique, there is 15 to 30 degree for the extraction of lower left, but in this technique for all quadrant patient is inclined at 30 to 45 degree, and for all quadrant dentist stand behind the patient, but in British technique dentist stand behind the patient only for the fourth quadrant. So this is the basic difference between British and North American technique. Now basic steps in forceps extraction. Firstly, we grasp the tooth, that is engaging the beak 1 to 2 mm beyond the CJ. Okay, expansion of bony socket take place, then mobilization of tooth and the delivery of tooth. There is two fit, 2-point contact or 1-point contact of the forceps. Now basic forceps used to mobilize the tooth. Then what are the forces? They are apical pressure, buccal force or traction, lingual or palatal force, rotational force, and traction force, that is pull it out force. Okay, what are the role of operator hand? It plays a very important role. The opposite hand plays an important role in supporting and stabilizing the lower jaw when mandibular teeth are being extracted. Okay? जब मैंडिबुलर टीथ को एक्सट्रैक्ट करते हैं तो जो हाथ हम यूज़ नहीं करते हैं, दूसरा हाथ, उससे हम दूसरे टीथ को सपोर्ट करते हैं, जॉ को सपोर्ट करते हैं फॉर द एक्सट्रैक्शन. नाउ द अपोजिट हैंड सपोर्ट्स द एल्वियोलर प्रोसेस एंड प्रोवाइड टेक्टाइल इंफॉर्मेशन टू द ऑपरेटिंग सर्जन concerning the expansion of the alveolar process during the luxation period. When we luxate the tooth, the opposite hand provide tactile information. Okay. Now application of force related to tooth morphology. Today we will be studying about only maxillary tooth, and in next class we will study about the mandibular tooth and what are the techniques. Now maxillary anterior, they have conical roots, lateral incisor being slightly longer and slender. Canine usually have the longest root. The alveolar bone is thin on the labial side, so the initial movement is in the labial direction. A less vigorous palatal force is then used, followed by rotational force. क्योंकि बकल प्लेट थिन है, इसलिए हम पैलेटल साइड फोर्स नहीं देते, बकल साइड फोर्स देते हैं. अगर हम बकल साइड फोर्स देंगे मतलब हम पैलेटल प्लेट को लूज कर रहे हैं, क्योंकि बकल प्लेट थिन है. ओके, इट्स वर्क इन अपोजिट डायरेक्शन, ऑलवेज रिमेंबर. Maxillary first premolar, bifurcated usually in apical 1/3 or 1/2 of the root. Root extremely thin and subject to fracture. So rotational force कभी यूज़ नहीं करना चाहिए maxillary first premolar में. Buccal pressure is always greater than the palatal pressure. Rotational force should be avoided. Maxillary first and second molar have large root. Buccal roots are relatively close together. Strong buccal force is used with minimal of palatal force. And for maxillary third molar, it depends on the morphology. Always go for a pre-operative radiograph and plan accordingly whether to use forceps, whether to use elevator, or how to extract the teeth. But always remember more of buccal force or traction and less of palatal. So this is all for today class. We'll continue the mandibular teeth in the next class. Till then, like, subscribe and comment. Thank you.